Hi, and first, before I begin, I would like to acknowledge the traditional custodians of the lands on which we're meeting on today, and to pay my respects to all women, elders past and present and emerging. This is a traditional greeting that we give in Australia to our First Nations people. But I'd also like to acknowledge the lived and living experience of people with mental health conditions and or emotional distress, and to acknowledge the experience of their families, carers and kin, and recognise the contribution that people with lived experience of mental health conditions have made to the world globally, and will continue to do so because of their lived experience. So I'm going to talk today about the World Federation for Mental Health, but I want to just say at the beginning that this presentation is a part of one that I gave back in 2022 in London for the World Federation's Congress, and it was developed by Dr. Ingrid Daniels, who's the CEO of Cape Mental Health in South Africa, and also Dr. Tracy Bone, who is a professor at Manitoba University in Canada. So I thank them for allowing me to continue to discuss this situation. So the World Federation for Mental Health is an international volunteer non-government organisation that looks at mental health promotion. It was established in 1948, so with the two other large organisations of the World Health Organization and the United Nations. Our aim really is to look at improving conditions for people across the world around mental health promotion. So looking at what is best practice in recovery-oriented approaches, but also to uphold human rights and to try and reduce stigma and discrimination. So though we've been around a long time, there's a lot of people don't know about us, and that's understandable. So I'm going to, you were on to slide 2. Okay, now here, that I've got to do it. Thank you. There you go. So I'm just going to talk briefly about a quick history of women's mental health within the Federation, and to show how women have spoken out in the past and how their voices are being heard today. So Dr. Margaret Mead was the first woman to be elected as the Federation's president. That was in 1957. Wow. Dr. Mead was an American cultural anthropologist, author and speaker. It's reported that Margaret's great fame was owed as much to the force of her personality and her outspokenness as it was to the quality of her scientific work. So she was a great advocate in voicing concerns about women's mental health back in the 1950s. Dr. Mead then paved the way for other pioneer women working in mental health, such as Dr. Estefania Aldaba Lim, a psychologist from the Philippines, who held the president's position from 1983 to 1985. Dr. Lim was a strong advocate for women and children. In 1979, she became the first woman to become Special Ambassador to the United Nations with the rank of Assistant Secretary General. Then we had Edith Morgan, OBE, who was tasked with organising the Federation's 1968 Congress in the United Kingdom. Edith Morgan became the Federation's Vice President in 1977 and eventually served as President from 1985 till 1987. During her time at the Federation, Morgan established the European Regional Council that in 1998 changed its name to Mental Health Europe. Mm-hmm. Then we had Rosalind Carter, a former First Lady of America, who was a member and played leading roles in highlighting the plight of women's mental health. She continuously advocated to improve the quality of life for people with mental illness. In 1996, the Carter Centre was established with the first International Committee of Women Leaders for Mental Health being held the following year. The committee members were from royalty, they were First Ladies and heads of state. Beverly B. Long was an American activist who became a formidable advocate for people living with mental illness. Between 1995 and 1997, Beverly Long served as the president of the Federation. She also worked with the United Nations on issues related to mental health. She was appointed by the American President, Jimmy Carter, to be a member of the President's Commission on Public Health in 1977. The first presidential commission formed to address issues of mental health policy. Today in the room, one second. Okay. Today in the room, we're fortunate to have women, as Nancy spoke about, who attended the very successful NGO Forum of Women and the United Nations Fourth World Conference on Women 30 years ago in Beijing, China. They are Nancy Wallace and Ricky Cantorith. They were in Beijing with the then President Beverly Long. These women presented one of the first panels on mental health and were able to ensure, through their fantastic advocacy, that mental health was included in the Beijing Platform for Action. So, as you can see there on the slide, this is a newsletter article from that day. In 1992, the first World Mental Health Day was observed on the 10th of October. World Mental Health Day is the Federation's annual mental health promotion program. The day provides a platform for all of us to stand together, to raise awareness, to try to reduce stigma and discrimination, and to share resources and support others no matter where we live. In 1996, for the first time ever, the theme for World Mental Health Day focused on women and mental health, with the following year becoming children and mental health. As we just heard a little second ago, we are now grateful to have the International Day of Hope organised. Thank you to Catherine over here. And that will be on the 12th of July, the first time this year. So the Federation's first committee on women's issues was held in Finland in 1997. So this is a newsletter from that time. Since 1997, there have been 5 other female presidents of the Federation. They are Mrs. Pekka Lahti from Finland, Dr. Pat Franciosi from America, Shona Sturgeon from South Africa, Deborah Wan from Hong Kong, Dr. Ingrid Daniels from South Africa, and we have the next president for the World Federation is Professor Sabine Baha-Koller from Switzerland. Many other women have made significant contributions to the World Federation. I'm only just really talking about the presidents, but just sitting here at this table and in this room today are a number of women who have worked hard to reduce stigma and discrimination, to uphold human rights, and to look at how we can all work together better to improve the health of people in the world who are experiencing mental health issues. Of course, my focus is always going to be, we have Sylvia over here, let me not forget Sylvia, thank you, from Argentina. We've got a long way to go, and we know that even though the World Federation has been operating for 75 years, women's mental health still remains an issue for us. So in 2000, the World Health Organization, in their Women's Mental Health and Evidence-Based Review, stated good mental health is intrinsically important, conferring a subjective sense of emotional well-being on the individual woman, and extrinsically important, representing a significant resource to the broader society in which she lives and works. Women within the Federation understand and acknowledge that each woman's cultural, social and biological factors must be considered, with the elimination of gender-based violence, stigma and discrimination being essential to enhance women and children's well-being. We we really want to support and understand, and having been on the World Federation's board now for 8 years, I understand that as a global society, we have so many different levels of care and support for people experiencing mental health conditions. And, you know, I'm from Australia. I think we are resource rich, and yet we have rising incidence of youth mental health problems, high levels of anxiety and depression. So I'm very keen that we follow the World Health Organisation's 2021 report, which was the guidance on mental health, on community mental health, which remains a kind of landmark document for us all. So the Federation has member sections which provide an opportunity for people who share a common interest in a particular subfield of mental health to research, collaborate, develop topics of interest or concern for the Federation to consider. Member sections evolve to meet the interests of members, with past sections on human rights, peer work and lived experience, addictions and trauma. Today, the sections are working on community mental health development, spirituality and mental health, workplace mental health, youth mental health and women's mental health. And that's what I'm the chair of at this moment in time, following from Nancy's leadership prior to that. So the women's mental health section has a long history of influencing discussions and providing global advocacy on women and children's mental health. Members or volunteers work to emphasise the human rights, socio-economic and political challenges and effects of all that impacts on the mental health and well-being of women and children. And we all know what those examples are: climate change, war and conflict, violence and trauma. Section members choose to be active participants, and as we've spoken about, or they can be silent and supportive. That is everyone's choice. But we can engage in topics of concerns. Recently, Ingrid Daniels and Eunice Nayas, who, if you were here yesterday, you would have seen speaking, on behalf of the Women's Mental Health section, have developed a declaration on women and children in war and conflict zones and the impact on mental health. This is a very important document that we need to be distributing wider. So as we heard, since 2020, Women's Mental Health section, and you know, because of COVID, we've focused on webinars as a tool to increase awareness and discussion on topics impacting on the mental health of women and children. So we created a poll of members. We looked at what are the issues for the world, and then feedback from webinar attendees, and then we look at the theme each year for World Mental Health Day and choose the topics. So we've had a number of webinars, and these are just a few of them: resilience of women in disasters, gender-based violence, women living in poverty, human trafficking of girl children and women, climate change, etc. But our next one will be looking at mental health services for women in Latin America due to the recent political and socio-economic changes impacting women and children, as Sylvia told us about yesterday. I keep flicking over my shoulder hoping that it is working, but I'm assuming it is, yep. So I kind of just want to say that there's global dread and foreboding at the moment. Women are living with uncertainty and the reality of many possible avenues for change. Cost of living expenses, unemployment, impact of climate change, which we see a lot of in the Pacific region where I come from. Increasing war and conflicts, and these amazingly devastating impacts on mental health. People are scared, and rightly so. We saw in Australia, I don't know if you know, but we've had cyclone hit us recently in Queensland and flooding, which impacts on the eastern seaboard. But then in Western Australia, we've had bushfires, all happening at the same time in the country. So people get scared. We see that shelves in stores suddenly disappear of toilet paper or bottled water, or, you know, so people are scared. We understand that. There's a lot happening. So as a global community, we need to advocate for human rights-based approaches, for greater investment in community-led and peer-run mental health initiatives that provide real alternatives to hospital and crisis-driven care. We need to ensure easy and continued access to quality mental health services, especially for women and children, but where and when they need them. We need to reduce violence and to build mental health literacy and to boost resilience, and health comes for everyone. Women volunteering with the World Federation for Mental Health remind us that kindness, compassion, hope and equity are needed now more than ever. As we all know, women's rights are human rights and human rights are women's rights. I quote Maya Angelou, each time a woman stands up for herself without knowing that she stands up for all women. Thank you.